your understanding of this card. If you understood it well, you can directly start it because examination point of view, the
Yeah.
card is given and 3 minutes is your preparation time. Directly, you have to start to speak about the card.
Yeah, okay. I'll
Yeah.
start.
Yeah.
Good morning. I'm Dr. Garima Arora. I'll be the doctor attending you here at the clinic today. So I gather from, first of all, how may I address you today?
A very good morning, a very good morning, Dr. Garima. And my name is Ruby. I'm 88 years old. I live an independent life, never dependent on anybody, though I'm 88 years old. But it is quite, nagging me that I suffer from this urinary tract infection. So I'm afraid, how to protect myself from this and how do I get this urinary tract infection? What triggers it and what is the treatment? Could you please explain it?
Yeah, I gather from the chart that you have been having a couple of UTIs recently. Must have been very frustrating for you. A few questions about your lifestyle. Like I would want to know about your diet, your daily fluid intake, and your exercise routine.
Well, that's a good question. So I'm 88. I'm an active person. I get up early in the morning and I do some walking and yoga, meditation, and also I have a good eating habit and I drink plenty of water, juices, and fresh fruits and vegetables, and also I drink at least 2 glasses of water per day. But I'm habituated to drink coffee at least twice or thrice a day. Yeah, this is my habit.
Well, that's a good routine. I must say, you have. I would like to suggest that maintaining adequate hygiene is equally important as well. I understand your habits are wonderful. You have a wonderful daily routine, but maintaining is equally important. Do you have any idea about double voiding? Or for me to go ahead and discuss it with you?
To be frank, I have no idea about this urinary tract infection and I have no idea on it. If you explain, that could be better, doctor.
Yeah, urinary tract infection happens when there is this mostly because of maybe a physiological or a physiological problem. Urinary tract, we do not maintain an adequate hygiene. Frequent, often not very frequently, that needs to recommend care. One of the ways to prevent it is uh, habits like double voiding, as in where you empty the bladder. Once you feel that yes, okay, I emptied it completely, then you wait for a moment and then again try to empty again. That the residual urine also in the bladder gets emptied and you do not, this helps prevent further UTIs. Uh, Anything else? Or should we go ahead and discuss the treatment?
Well, now I got an idea about this double voiding, which I never do earlier. Let me follow it. And with regard to that, I just like to know what kind of things that could trigger this urinary tract infection, and what are the precautionary measures do I need to follow that I should not get further infections in the future?
So, yes. First thing which you do, as you said, have fluid intake, which you do. Second thing, have maintain a good personal hygiene. Washing down there is very, very important. Third thing, as I've suggested, avoiding would be a good idea. You should go ahead and try it. And then I would also be suggesting a long-term treatment plan, which is uh, short dose. Yeah, okay. So I'll start again from the precautions. Yeah. So there are 3-4 things you can do. Firstly, as you have you already do every day, maintain a good fluid intake. I assume you're doing it already. Second thing is maintain a good personal hygiene down there, adequate washing and cleaning every time you urinate. Third, as I've just mentioned, double voiding would be a great idea. try and adapt that into your daily habit. And the fourth one, I would want to prescribe a short duration of antibiotic for this UTI, as well as a long-term low dose antibiotic to prevent further recurrences. So shall we go ahead and discuss that?
Yes, yes.
So yes, I'll be prescribing trimethoprim 300 milligrams daily for the next 3 days, which you have to take for the next 3 days. And then also with that, a low dose nitrofurantoin will be added for the next 3 months. So adding that would prevent further UTIs, and we can always follow it up.
Well,
Anything else?
doctor, I would like to know about, why this urge to, urinate frequently, and also I get a kind of pain in my pelvic region, and sometimes I urinate with blood, right? And I have a doubt, and I'm afraid that would it lead to kidney stone or kidney infection. So what do you say on that?
I understand your concern. These symptoms must be alarming for you. Yes, recurrent UTIs do present as pelvic pains and at times hematuria, as you have told me, blood in the urine. And your concern is absolutely right. At times, urinary tract infection can ascend and lead to a kidney infection too. But having said that, I reassure you that if we treat this episode of UTI and also prevent further UTIs as I have suggested, I think you should be okay, and it should not accelerate further into kidney infection. But then again, if you have these symptoms persist, or you have a long pain or anytime, you can always come back and we can do further evaluation for that. Is that okay? Or does
Well,
that sound good?
well, it sounds good, but you have to consider my age, that I'm 88, right? So I'm just counting my days, and so even suffering from these kind of infections, it's better to leave this world with the dignity, I believe. But my last question to you is, what is your idea on this urinary catheter? How painful is that? Is it recommended for a person like me who is 88 years old?
Well, I'm glad you asked this question, Mobi. A catheter is another indwelling device. It's not going to help prevent UTIs. Rather, it is a source of getting new infections. So for me, I don't think it's a very good idea until unless you have frequent symptoms of urinary incontinence. It should not. I do not want to suggest it to you, and I would really. You have to trust me on this. That with adequate efforts, with the modifications I've told you, if you incorporate them into your lifestyle, and with the prescribed medications, you should be all right. Hopefully, you'll be able to prevent further UTIs. But
Yeah,
then
I
again,
told, right, I have this bowel incontinence and a blocked flow of urine, and so why is it not this urinary catheter is not recommended? Is it because of my age, or is it a painful experience?
it's not painful. It's not a painful experience. Yes, definitely, it might be a little uncomfortable, I'm sorry, but it is not painful. And about incontinence or in block, if you're telling me that you do have symptoms at times of incontinence and uh, feeling of block, I would like to further assess for it. Probably need further evaluation and investigation, and then we can probably go ahead and decide if we.
Well,
Uh,
that's a good suggestion, doctor. You could do almost as per know my health condition as well as my age, keeping all these points in mind, because I could not again and again, get admitted and treated for it. And also, as you told, that the medication, whatever it is, for a course of period, as you said, it is for a long duration, like more than 3 months of course, as you recommended. So I think if there is any permanent remedy could be there, that could be more helpful rather prolonging it. So that's my concern.
So I'm glad you asked this. As of right now, Ruby, this is probably the best we can provide. Uh, the long-term treatment is required for further preventions and further recovery, right? So that you don't come again and again with acute and we can prevent these problems you're having or the concerns you have, like if it will ascend to your kidneys or your problem of urine, blood in the urine again and again. So that which can be done as of right now.
Well, Doctor, anyhow, thank you for your counseling and explanation about the treatment and precautionary measures to be followed. Hope I could follow it. And if there is any kind of difficulties or uneasiness, sure to get back to you. Thank you.
Yeah, you can always get back to me. Wishing you a speedy recovery. Take care.